Hi, my name is Rachel. I'm going to have to introduce you to the unit topic in MedSurg that we are going to cover for this semester. The unit of interest is management of patient with renal function problems. You can call it management of patient with renal disorder, management of patient with kidney failure. For this unit, we're going to have an overview, some definitions about what it is that we know about kidney function. What is it? In looking into it, we're going to have a fine line between what can be a concern. What can we see when we are concerned with a patient having some renal issues? What do we see? As a nurse, we always have to have our ear and eyes on our patients. So when we're looking at these patients, we need to be able to picture or notice that something is going on, either from the lab value, for patient complaints, and symptoms. So we're going to go through that. And then we're going to have to differentiate between having an acute kidney failure or kidney disease versus having a chronic kidney disease or having end-stage renal disease. We're going to have to differentiate between both. At what time do we know this is acute? What time do we define this is a chronic, or this is end stage where nothing could be done anymore, only probably a transplant? We're going to look into those. We're going to look at developing a care plan for these patients because that's a framework that we really base our work as nurses on. And we have to look at, in the care plan, we have to develop a part that pertains to educating a patient. Because as a nurse, again, our role is to prevent patients from declining and prevent them from readmission if we can. So we have to include that in the care plan. So another area that we're going to look at will be medications, because most medication are nephrotoxic. So we have to really go through medication and see, because we have to use them in our education plan. And also in advocating for the patient, we look at the medication, we can contact the team or the provider and ask them to look into some of the medications as we are advocating for the patient. So we are going to look at, educating patients who are in dialysis, of course, inpatient, and also if the patient has to go home with a peritoneal or hemodialysis. And also we're going to look at taking care of a patient holistically, the patient who's going to probably go through a transplant. They have a lot of emotions. They have the family support that they need. We have to help these patients to understand the process and really preparing them of what might be some potential problem in the future. So this unit is going to cover this topic entirely. Of course, we're going to have some tests because we have to test the knowledge, but also we're going to have some funds. We're going to have to use a lot of online materials, and we're going to have to use also some activities with the fun, creatives. I am your facilitator. I'm going to work with you and I'm going to support you. Hopefully you guys have a good background that enables you to come prepared to this class, and be happy to work with you, and I'm happy to see you, and God bless you, and I see you in class. Thank you.